So while we're on topic of COVID-19, could you share how you were forced to respond quickly back in February?
We run our trips in February, July, and October. We run 3 times a year. And we first heard of COVID-19, obviously, in China in January. I was watching it very, very closely. We have partners in China. They were immediately impacted. They were quarantined in their home. And one of the things from the start of this is that those are my friends and colleagues in China. So it never felt like this is something happening to those people over there. It felt like this is happening to our family. This is happening to our friends. This is happening to our colleagues. And so I think I had a little bit of a sort of a closer relationship. And I was watching, I'm familiar with exponential growth. I was watching the curve. And I'm trying to think of what the date was. It was probably the last day of January. And I just sort of started thinking, we don't know what country this is going to next. This is obviously leaving China. And I think there had been a few cases in other places in Southeast Asia. And I began to just think about disease transmission and possibility of a pandemic and thought, I'm about to put 75 people on airplanes to 15 different countries. And no one's canceled travel yet. No travel had been canceled except for to China. We'd obviously canceled our China trips at that point. But what if we contributed to the spread in some way? Because this has the possibility to become a global pandemic. That was very clear to me when I was watching the growth. And so again, no one had canceled travel. It was the Saturday before teams arrive on Tuesday. Some people are already in New York because they make the most of it, come to New York City. And I had to make a call that I knew would completely impact our financial standing as an organization. And that became the last thing I cared about, honestly. The very last thing I cared about was where we were financially. The only thing I cared about in that moment was people's health and safety. And I knew that there was a possibility of contributing to the spread of this. I knew that there was a possibility of somebody being in a country being quarantined. There were too many of those sort of unknown things as a country. We weren't really paying a huge amount of attention to this. And so again, people are already in New York, people are on their way. Suitcases are packed for the most part the weekend before. For a lot of people, they've never left the country who travel with us on Skill Corps. And so this is a very big deal. And we made some phone calls, sent out an email, and we said, we've canceled the trips. And our first thought was we would postpone, which thankfully we did not, because we thought late April, early May, and obviously no one's traveling now. Mm-hmm. But it was one of those decisions where you had to go, gosh, this feels like a really hard decision. Wait a minute, no, what do I value above all else? People's health and safety. Okay, this is an easy decision. Mm-hmm. This is easy. We have to work out the logistics of it. We have no idea what it's going to look like. At the time, airlines weren't doing anything about it. People were mostly understanding. I did get an email from one person who was going to be meeting her boyfriend in Italy afterwards. And she said, obviously Italy's going to be fine, which as we now know, Italy was not fine. And so, about a week after making that decision, Amazon canceled going to their big thing they were going to in Spain or whatever, and then things started getting canceled. But it was one of those moments where it was not the popular decision. No one else was canceling things at this degree. Now it feels very normal that everything's getting canceled. And I remember thinking it's either going to feel really normal and everything's going to get canceled, or we're going to have overreacted. And I have to be equally okay with either. Mm-hmm. And I am. We now know we did not overreact, but it was not a popular decision. It was not a decision that I ever thought I'd have to make. It was not a decision that we had a contingency plan for. We have contingency plans for canceling some trips. Of course we do. Mm-hmm. We don't have a contingency plan for all of our trips at once. So I think what it really was, though, is it was It was decisive action. It was what I know leadership to be, which is at some point you have to get silent and you have to trust your gut and you have to come back to what's the most important thing right now? Health and safety above all else. I honestly didn't know how the organization was going to continue with that loss of a third of the revenue. I really didn't. And now here we are 2 months later, to the day, actually. And we've now had to cancel all of our trips for the year. And we've now had to cancel Global Summit. And in this exact moment, we honestly don't know how we're rebuilding from this. We know that we will. We know that it'll be better than we ever imagined. We know that this is the greatest opportunity we've ever been handed as an organization. But none of that matters right now. What matters to me is that my team is safe and healthy. That's what matters.
You've been watching Autism Knows No Borders. If you like this video, please give it a thumbs up and subscribe to our channel. Also, we'd love to hear from you, so let us know what you think in the comments section. Click here to watch this interview in its entirety. You can also find us on your favorite podcast app. Tune in each week for engaging conversations of how people across the globe are inspiring change and building community. Thanks for watching. Take care.